special ops, OPS, ozone, peptides, and supplements. In Robbie's case, we started off with ozone injections into his paravertebral muscles, his low back muscles, basically. The studies have been done injecting ozone directly into the disc, which are four inches deep into the body from the back. I discovered during my time in San Antonio as a pain management specialist that this may not be necessary. My targets for injections into the back using ozone and to affect the painful discs and even the sciatica type pain. Welcome to the Future of Wellness, MD. I am Dr. Adrian Escontrias. I am a anesthesia and pain management specialist practicing in El Paso, Texas. That kind of pertains to what we're doing here. Special ops, OPS. This pertains to ozone, peptides, and supplements. These are the three therapies that we use in combination to obtain a better effect, more complete pain relief in our patients. The Wolff protocol describes in detail how I use the combination of ozone, peptides, and supplements in a successful manner. So number one, ozone. In Robbie's case, we started off with ozone injections into his paravertebral muscles, his low back muscles, basically. The studies have been done injecting ozone directly into the disc, which are four inches deep into the body from the back. Robbie himself did undergo this a couple of years back in Puerto Rico, and apparently it was brutal. It hurt real bad, and the disc does hurt when you inject it. I discovered during my time in San Antonio as a pain management specialist that this may not be necessary. My targets for injections into the back using ozone and to affect the painful discs and even the sciatica type pain. The target I use is the fascial layers around the erector spinae muscles. The fascial layer is simply the connective tissue covering around muscle bellies that envelop all our muscles. And studies have been done that prove that there is a direct pathway from the outermost fascial layers directly through other fascial layers that lead to the paravertebral space, as well as possibly the epidural space. So I'm assuming and guessing this is the mechanism by which my injections have helped Rob. He did have extrusions, disc extrusions at L2, L3, L3, L4, and L4, L5 on the left. And what I did, I located those three levels with ultrasound and very simply injected some local anesthetic and ozone at a concentration between 7 to 10 gamma, which corresponds to 7 to 10 micrograms of ozone per ml. And I placed 3 to 5 cc's at each target site. I also included the left SI joint to be injected with about 5 cc's of the ozone mix at the same concentration. We repeated these injections 3 times with 7 days in between, so 1 week apart. At the end of the 3, approaching the 3rd injection, I supplemented his ozone exposure with MAH ozone therapy, which is ozone into the blood. The blood was collected in an IV bag, 60 cc's worth, and diluted into 60 cc's of saline. In that, I injected 60 cc's of an ozone oxygen mixture at 35 micrograms per ml. This mixture was then reinfused into the patient, and that was it. And the second portion of the Wolff protocol consists of utilizing the peptide twice a day. And the third part of the Wolff protocol would be the supplements. Now, this is something that's very important, and you can do this without having to consult anybody. The supplementation portion of your self-care, it really is easily done and should be done pretty much by everyone. What I do for myself is I do take the core of my supplementation regimen consists of 4 things. The first being NAC, N-acetylcysteine. The second being a nice B complex vitamin without folic acid, no folic acid. Instead of folic acid, I'm sure that I take, the third would be the vitamin C at 3,000 milligrams per day. And finally, round it out with a nice collagen. The NAC in general is for liver support. It replenishes and regenerates your liver's glutathione. Vitamin C does work in combination with the collagen to repair connective tissue, soft tissues, and even bone. This is why having a good baseline supplementation, especially before surgery, is very important. Will possibly help the healing process. Well, all right, that's a brief description of our Wolff protocol. Look down in the description for links to the scientific papers that would describe ozone for low back pain, as well as for facet injections, and also for treatment of fibromyalgia. I'll also include a paper that describes the fascial plane connection to the paravertebral space and possibly the epidural space. That's the evidence. And of course, we all like to hear is the anecdotal evidence. Well, like I said, our friend Robbie, he was really suffering when he first came to me a few weeks back. We did what essentially amounted to the Wolff protocol, just like I described. And at this time, he can confirm that he is back playing volleyball and feels over 90% improvement in his chronic pain. So this is once again Rob Wolff. Robbie, welcome, and let's hear your side of the story.
Yeah, thanks, Doc. I got to tell you, it's a good thing that I found you because I'd actually gone through this issue before in 2023. I actually was trying to remove a stump, and of course, I thought I was stronger than the stump, and I was not. And then I essentially blew out my back L5S1 extrusion of the disc, and it's pretty harrowing because when I went in and I had talked to the doctor, he said, "Okay, well, it's going to be surgery, and that's pretty much it." And of course, when you're a hammer, mm-hmm. Everything's a nail. Absolutely. So I said, no, I've been in healthcare for 2 decades. I don't know anybody who's got a back surgery and is walking around perfectly. So I'm not going to do that. I said, let's do an MRI to see what I have. And it confirmed exactly what we thought it was. It was an extrusion, L5S1. And from the time that I got the MRI, which was November 2023 to May 1st, 2024, I had a massive shrinkage. And it was actually, it healed up and it closed. I had a little bit of a herniation, but in 6 months, essentially, I had gone from not being able to do anything, walking with a cane, to running, jumping, playing sports again in only 6 months. And I got to tell you, it felt pretty good to be able to do that.
All right, Rob, that's very, very interesting. So what we want to know is, what did you do to get yourself from your worst condition to your newfound life where you were able to actually become human once again and were able to walk without pain? Describe that.
Well, I mean, it wasn't easy. I did a couple of different things, to go from, that herniated extrusion of a disc into essentially being healed up. It took a lot of things, and it's all in my mind, everything's by percentages. So there are things that you can do to reduce pain. There are things you can do to heal up. And this is what I personally did in 2023. The first thing was I had a low stress and a pretty good diet. I'm mostly on a carnivore diet, and I've been doing that for quite some time. And if I had a high stress, really bad diet, it doesn't matter what else I do. I just won't be able to get there. So I always think that's number one. Second thing was I used Bob the physio for physiotherapy, and he was great to tell me like, hey, it's going to be all right. You made a right decision. You can do this, and kind of like that mentality. So that was a big factor. I did infrared red light and contrast therapy, hot and cold, ice baths, those type of things. I took anti-inflammatories, turmeric being one of them, and of course, the ibuprofen, stuff like that. And then I did also some other type of therapy, which is a little bit alternative. I did acupuncture, which I did not believe in, but I think acupuncture was a pretty big role, about 10, 20%, to get me back to where I was supposed to be. I went to a chiropractor for pressure points. I even did fasting to kind of get rid of all the excess junk in my body, kill all those zombie cells and get me fresh. And then there's this one, which is kind of funny that we're talking about this. I did prolozone therapy. It's essentially ozone therapy. And like you explained to me, it's like ozone therapy, but with medications and supplementations built right in. And it was a fat, huge, long needle that went right into my spine, right into my disc, and it was injected that way. And the difference here from what we did was that when I went there, this was in Puerto Rico where I live, the doctor was a great guy. He said, this is within 24 to 48 hours, you're going to be a brand new person and it's going to be great. And you're going to be essentially healed. I was like, okay. And I put it at that 0 to 1 level of what it did for me, because I don't think it did anything at that point when I created that list. Now looking back, I know that an extrusion of a herniated disc, for me to heal in essentially 6 months, is pretty great, because the literature states it's mostly like a 12 months to 18 months out before you get pain relief into where you're actually back. So I think
you did quite well.
Right. I think prolozone therapy did pretty good back then, but that would take us into this next level. So any questions you got?
No, well, just to add to that, we have to manage expectations. You can't guarantee or promise any level of recovery at any certain time. You give ranges. Just like yourself, you're great when you predict financial issues between 0 and 90%. You're pretty sure something's going to happen in your podcast. Here, we have to leave it open-ended. We have to deal with the results of our therapies as they come along and adjust if necessary. You did quite well. Now, fast forward to the past couple of months. What did we do different this time? Take that away.
So it's a little bit different this time, because I'll tell you that when I went through this whole procedure, I thought that I'll never get healed, and it actually went through. Everything was, felt pretty great. And it lasted me pretty well until February 15th, 2026, when I used improper body technique or lifting technique to lift up a gate, which is in excess of 500 pounds, and use essentially my whole back. And it felt the exact same thing as when I tried to lift up that stump. It just was a sharp pain, radiated down to my right side. There was almost like fire. And I knew it as soon as I did it, like I just messed up my back again. And I know it's going to take a very long time. So from there, I was pretty much incapacitated for quite some time, for about 2 weeks to a month. And I was just trying to get myself back. And it felt again like an extrusion. And for me, for an extrusion, I thought, well, if I just have a bulging disc, it won't be so bad. But it felt the exact same way. Back to a cane, back to the pain, back to being bedbound. It just pretty much sucked. So what I did was I did a couple of things. First of all, this is my MRI from June 1st. Right now we're on July 1st, 2026. This happened in February. And at this point, when I went to gate it, I was already pretty much back to 90% of where I was. I just wanted to verify that things had actually healed. Even on this one MRI, it did say that I have a little bit of a broad-based disc bulge. Whereas before, what I felt was essentially an extrusion. We can see that, here it is. It's a little bit of a bulge, but not too bad. So what did I do from February to June 1st? I did this, the same thing, except with a twist. The low stress was a must. Again, I don't think anything you do, you got to have this. I went back to Bob, the physiotherapist. We worked together, felt pretty good. And this time I did ozone therapy and
Hey,
peptide therapy.
yeah,
And I did that with
yeah.
you because you're the only
Mm-hmm.
one in El Paso that's actually doing it. And I split
Yeah.
time between Puerto Rico where I live, and then I come here and vacation in El Paso for
Hey.
business. And I did ozone therapy because again, when I read the literature about ozone, I think that was a defining therapy. It's just that the time frame was
Absolutely.
off. So we did that. We did one running, but could still do it.
Wow.
Bounce, jumping a little bit, playing a little bit of volleyball, and not too bad. Now it's July 1st. We just finished up a tournament last weekend. I'm doing just fine. So I did ozone and peptide. Those are, I would rank them an 8. Infrared and red light, contrast, did those again.
Mm-hmm.
Anti-inflammatories. I did some fasting again, but who knows how it is. So that is essentially what I did to get back here. And this time, when I started ozone was what, 2.5 months ago, 2 months ago?
About 2, yeah, easily.
And then with the peptide therapy in conjunction with everything else,
That's
I just
wonderful.
I think
Yeah,
it's a winner. So that's what I did, Doc.
yeah. So, judging from that list, 8 different things. Everything is done in combination with everything else. Not one effort, not one technique will probably be successful. You got to use multimodal therapy, they call it,
Hmm.
um, including diet. My God, diet is very, very important. Um, and stress, how about that? That's huge. And just to clarify, the injection sounds scary. I mean, when Rob had it done in Puerto Rico, they use a spinal needle. It's about a 4-inch needle to get all the way deep into the disc itself. Quite uncomfortable. What the way I do it, I don't use that kind of needle, that kind of length of a needle. I use a regular needle,
Right.
and I inject into the coverings of the musculature around the spine, the fascial layers. And my theory is those layers track all the way to the epidural space, and you can inject anesthetic and then follow it up with the ozone, the gas, and it may reach all the way to the paravertebral space and even the epidural space. I have linked some studies that essentially prove that there may be a connection. Um, so, in other words, bottom line, you don't have to use a big needle. You don't have to inject deeply. It's a shallow injection, almost ridiculously simple. The caveat is you got to use ultrasound to place the needle tip accurately. And that's really the only different thing, the only difference in this injection compared to your previous injection. And of course, we use peptide therapy, which wasn't available back then.
Right.
Of course, we're still waiting on the legislation to come through on that later this month.
Yeah, we'll see. And you know what? I will say it was a lot different to put it into the muscle because it didn't really feel like too much at all, as opposed to that big 4-inch needle. So then,
Exactly.
so we had that, the ozone therapy, the anti-inflammatory response, or the inflammatory response, which leads to anti-inflammation.
There you
And
go.
then I always look at it like there's a cleanup crew, and then there's a
Mm-hmm.
rebuilding crew. And ozone therapy is kind of like the cleanup crew because it incites that inflammatory response. And then you also told me about supplementation, which I thought, my diet's good enough. But you told me if you
Yeah.
want to repair that disc, it's going to be vitamin C, it's going to be collagen, which I got collagen peptide therapy, which worked out pretty great. And then I think it was vitamin D. And I don't know if there's anything else, but that was a big one. Vitamin C, collagen, vitamin D, and what else was it?
D3/K2.
That's what it was.
And that's the repair crew. And the repair crew takes longer than the cleanup crew. So that's why your time horizon may be weeks to months to see your final result. And then of course after that you might want to maintain your gains by good living, maintaining supplementation, and maybe more regular ozone therapies. I just wish that there were more ozone therapists around. They're usually located in the bigger cities, East Coast, West Coast, Dallas, Houston, Phoenix. Uh, it might be worth for you to travel to them every 4 to 6 weeks just to get this therapy to maintain your body.
Yeah, take a vacation. So Doc, I want to say thanks, because I don't think with all these things together, I wouldn't be here. It would just take longer, and it would just be more of a pain in the life.
There you go. And unfortunately, you may have been headed toward the surgical route.
Right.
The surgeons, they're chomping at the bit. Well, no, I shouldn't say that. That's what they do, and they don't. The knowledge isn't out there that, hey, there may be another way to treat this more holistically and more conservatively. Let's give it a shot. And hey, if you need surgery, by all means, it's available. But why not enter this into your discussion? So, a more conservative therapy that might help you avoid surgery, or at least postpone it. How about that?
I'll take it. I'll take it as a W.
You're a big W.
Well, thanks, Doc. I appreciate it.
All right, that's Rob Wolff, the namesake of the protocol. Okay, thanks so much. We'll catch you next time.